Hi my nurse loves, this is your nurse bae Renika, and I want to say welcome back to the channel. And if you're new, I am glad to have you here. We've been getting a lot of new subscribers lately, and so I just want to say to you guys thank you for subscribing to the channel. If you've been commenting, if you've been liking, I want to say thank you. At the end of the video, I'm going to shout out one of my nurse loves that continues to support me by always leaving a comment on my videos. Well, actually, I'll shout out two persons. So I was thinking of which video to bring to you guys next. I figured, why not just go over the different specialties that we have here in our hospitals, and to piggyback off of that, the different credentials that you would need. So with me saying that, in my last video, I did drop the requirements that you would need to register with the Nursing Council here in the Bahamas. So this is also for nursing students. If I have any nursing students that's watching this video now and you're coming into the nursing profession, I just want to inform you that these are nursing credentials that you would have to go and get, or certifications. Now, for a lot of you that are already nurses, I'm sure that you would have these already because these are international. And I guess just to reiterate, I'm making this video. So basically, just as any other hospital, there's a wide range of nursing specialties that can be done here. So for a lot of them, luckily, you don't really need to be specialized, as I was a NICU nurse for about, I think like about 6-7 years. I was a NICU nurse, and I've never had a specialty or anything like that. I don't even have a certification in that. So that just goes to show that you don't necessarily need to be specialized in these areas, but it would be a great help, a great look on your resume if you did. I'm just going to list off the specialties that we have in the hospital, or that, you know, my hospital offers. And of course, that would include your med-surg nurse. You have your medical patients, you have your surgical patients. Okay, now that covers a wide vast of the hospital. Like, most of our patients come under one of those areas. Okay, in terms of that, you now have your dialysis nurses. Okay, because sometimes you have dialysis patients on the ward that have to go for dialysis, and then we also offer outpatient dialysis services. Okay, you have now your A&E nurses, what we call accident and emergency. You may call it ER or trauma. So you have your emergency nurses, and then you have NICU nurses, ICU nurses. So those latter two can be grouped into critical care. Like I said, it'll be best to be trained and certified to work in those areas to make sure you know what you're doing. Sometimes you just go to the area and you just pick up on things, you learn things. It's definitely a learning experience. So basically, I would say if you can work in an ICU setting, you can go anywhere and work, because even on the medical and surgical areas, you have patients that may belong in ICU, but ICU may not have beds, and so you have to nurse the ventilated patients on your med-surg ward. Okay, so sometimes that's how it works for us here, just to keep that in mind. On top of those, you also have your maternity nurses, your labor and delivery nurses. We call it maternity. So you have your nurses that would care for the mothers pre-baby, while they're in labor, and then post-baby. I know I've gotten some questions asking about if foreign nurses can work here in midwifery. I can't exactly answer that question, but I know we do need midwifery nurses. There is a demand, a great demand now for midwives, and so I would say to definitely try and apply, because they are needed. There's actually now a program that the hospital is putting on for persons to be trained in midwifery, and so like I said, they're definitely looking for, so I would say to definitely try your hand and apply. If you have midwifery experience or certifications already, you may be able to come and jump straight into it, or they may ask you to do the course. Okay, you may have to do the course over, and so if that is you, I would say to definitely try and apply. I almost forgot, PACU. How can I forget our PACU nurses? surgery is a big part of healthcare, right? Although it says post, they actually deal with patients before they go into surgery and after they come out of surgery. And so I've actually worked in this unit for a few months as well. So it's a little bit different from bedside nursing, but you still come into contact with your patients, but it's like a fast turnover. Okay, so I actually really liked it, and I was getting used to it, but then I had to return back to my first love, which was NICU. And then you have your OT nurses, your operating theater nurses that's actually in the room with the patients as the surgical procedure is being done. And so these areas are very important, they're very critical. And so like I said, you may not necessarily need to have a specialization or a certification in these areas, but it would be really good to have it. It would be really beneficial to you if you can have those certifications already, if that's the area that you're looking to get into. Of course, now you have your pediatric unit where you work specifically with children. So in terms of certification now, the main ones that are important to have would be your BLS, your ACLS, your NRP, stable. So of course, the area that you work in will depend on which one of those certifications you need. But for BLS, basic life support, everyone basically needs that, okay? No matter which ward you work on, just the fact that you work in a hospital setting, you should have your BLS, okay? Your ACLS, same thing, but it's your advanced cardiac life support certification. Everyone doesn't need that, but I think it'll be something, like I said, good to have. When I mentioned the NRP and the stable, they would be for places like NICU, where you deal with the neonates. PALS, if you're working on the pediatric ward, children's ward, like myself, that'll be something good to have, okay? And so, like I said, most of you may have these certifications already if you are already nurses. And also, if you don't have them, we offer them here. They sort of consider it like CNE. So you do get your CNE credit hours for doing these courses. They'll be available once you come here. So just keep in mind that these certifications, they do expire. For the BLS, I know it expires like after about 2 years. And so I would say that if you know your certifications are expired, they're no longer valid, I would say to try and get them redone. Try and get recertified before even applying to the nursing council, because like I said, if you watched my last video, you would have seen that you have to provide a summary of your nursing profession with the areas that you would have worked in. So of course you would want to include those certifications. Now, you don't want to include them if they're expired. It would not make sense, right? Like, what would be the point? So I would say to make sure that you're recertified in those certifications before putting them on your resume. Apart from those basic certifications, like I said, there is like a midwifery course, there's a NICU course, your neonatal intensive care unit program that they're putting on now. They're trying to get a dialysis program in the works, and I actually wanted to do that, but time will tell. Just wanted to bring you guys, like I said, the different areas that we offer here that you're able to work in, with the courses that they put on and certifications that you will definitely need. I think that is it for today's video, guys. Drop some comments, drop some suggestions of what you would want me to talk about and bring to you guys. I hope your process, because a lot of you are trying to get here to work, I hope that your process is moving along, you know, moving smoothly, or that you're at least hearing something back from the nursing council. There's only so much that I can do, but like I said, don't forget to drop those suggestions. Don't forget to text a friend, tell a friend, share the video, and help your girl get to 500 subscribers, on the road to 500 by the summer. And we're almost there, so I want to thank you guys, and look out for the shout out at the end of this video to see if it's you that I mentioned. See you guys later. It's time to get ready for work. Gotta go.